Hi, I hope everyone is fine. Today I will be discussing with you surgical steps of dental implant placement. I'm Dr. Ghazan Ali, practicing registrar at KSA. This patient landed in our hospital with the chief complaint of retained deciduous tooth with missing lateral incisor. On CBCT evaluation, we found his proper ridge width with alveolar height for implant placement. We discussed risks and benefits of treatment with the patient and completed informed consent. After documentation of informed consent, we mopped extraoral area, scrubbed it with betadine to decrease translocation of extraoral bacteria and decrease chance of infection. We are incising this area with greater palatine nerve block and infraorbital nerve block. After extraction of tooth, we are reflecting flap and making osteotomy with pilot drill. To check its angulation with the adjacent roots, we use guide pin and take extraoral IOPAR to check its angulation. After that, we are using sequential drills 2 mm and 2.8 mm. Our final drill should be 0.5 mm deficit from the implant fixture to achieve primary stability. You can check occlusal view of implant fixture. In this case, we have deficit buccal contouring at the apical area. We are augmenting this area with bone graft overlaid with membrane. After that, we are suturing the flap. We have sutured the flap with simple interrupted suture to achieve primary closure. You can evaluate closely. And to check its inclination with the adjacent roots, we are taking IOPR. We will evaluate this patient after 3 to 6 months for final process. Thank you.